We were fortunate enough to have Ms. Deb Reister. She's one of our advisory board members for HIT, agree to come speak with us today. She's been with the Infant Welfare Society for 6 years as the HIM director. And she's going to speak to you today and talk about her career in HIT. And then talk a little bit about, what was the second part?
It's just kind of the global health aspects.
Yes. So we welcome her and thank her for being here with us today. So do we want to turn out the lights? Let me know when you're ready. Switch over.
Can find the, let me do this with this one if I can. Now I didn't know that purple was the color for today. So that is, you know, look at the purple cups and everything. And I did this presentation yesterday or Saturday, I can't remember. It was great to have the lead-in with the professional mapping and so forth, which HIMA has, because I'm going to be talking to you a little bit about maybe different aspects that you could go into with your profession, because that's where my life went. And I pretty much owe that up to fate, actually, for me. Okay. Oops, I don't want to go that way. Make sure. So, first of all, I wanted to ask you, when did you know you wanted to be in health information? When did you know you wanted to come to school for this? You don't know.
Researching the internet and seeing that it's a growing trend.
Uh-huh. Okay. You
That's
thought
the right field to get into.
Uh-huh. Anybody else?
For me, it was, you know, my kids are getting older, but I still need to be involved, you know, taking care of my mother who's elderly, so just something that I knew that there could be an aspect of working at home.
Okay. Uh-huh.
For me, I've been in the healthcare field off and on for 10 years, and I didn't want to be a physician assistant or a doctor. I wanted to work behind the scenes of, you know, health information.
Yeah. That was always my thing. I never wanted to hear the whining and the crying.
Right.
You know? That's kind of not so good to say, but it's really about what you felt you could really take. When I found out was, I went to my high school counselor, and I said I wanted to be either in some kind of health or I wanted to be in legal, because I liked the legal aspects. And she gave me a book, and I started leafing through the book and came upon what was then medical records, and a really very little known topic in 1969. I graduated in 71, and I found that in the book, and that's what I wanted to be. And I never faltered. It always felt like the right thing for me, and I never faltered with that. When I went to school, I went to Mercy College in Detroit, and first of all, I was going for my bachelor's degree to begin with, but in the meantime, they had an associate's degree. They had the first year of the associate's degree. So they asked me in my junior year if I would do the associate's degree. And I agreed to do that and was one of the first 3 students to graduate out of that program. And got my associate's degree, and then went immediately on the next year to get my bachelor's. But because I got my associate's degree, I was able to do coding and go to a hospital and have a part-time job while I was going for my bachelor's degree. And I hear you talking about, oh, I'm going to go get my test, and you can do it every 6 weeks, or you can do it whenever you want to do it. Well, we couldn't do it all the time. We could only go once a year. They were always done in October when I was going through school. And I already had a job. But I recommend, as everybody else said, nobody primed us on these things, but get registered. And get registered as soon as you can. Don't wait, because it's correct that you need to get that under your belt, and it does upgrade your CV when you're going into places. And I went, as I said, I got my associate's degree. And that October, I went and got my ART. It was accredited record technician at the time. And I took that accreditation exam. But then I went and also got the registration, was an RRA at that time, which was a registered record administrator. So things have changed, history, a lot of things change over time.
Can I ask a question?
Sure.
If you have an RRA, does the HEMA recognize that as being the same as an RHIA?
Yes.
Oh,
Yes,
okay.
it was grandfathered a long time ago. The RHIA came in, you know, when I first started going to school, we were registered medical record librarians. That's what we were in the 60s. And yeah, so things, it hasn't, you know, it continues to change over time as the profession changes, and to stay up with technology and all of those kinds of things. So fortunately, I was in there before, the librarian had gone by the wayside, and we became administrators. So, but I carried RRA for a long time, and I want to say probably early 90s that it went to the RHIA in the 90s somewhere. I don't actually remember. Finding a job, what in your life affects your future? You never know what's going to affect you in finding a job. Everybody, I heard people talking about this. When I was a sophomore in high school, we had to read in our world history class, we had to read a Newsweek, and we had to answer questions. And in the Newsweek, there was an advertisement for Project Hope, which was an international health education foundation. And I always had the memory and the dream that I would like to be on that ship. It was a hospital ship that went around the world and helped people medically, brought them on board the ship and treated them. And it was always in my mind that that's what I always wanted to do. But how did I get there? So I wanted to go into the health profession. So I got into the health professions. One of the other things that when I was finding a job, as a senior in high school, we had an exchange student live with my family for a year from Brazil. And as part of my experience in life, I went to Brazil for 3 months in the summer of 1972. So I got a taste of international work and got an idea of how to do that.
How'd you like it?
I loved it. Yeah, it was wonderful. And so those were things, as I look back on my career, that affected what my decisions were, or how I accepted fate as we move through this. As I mentioned, always have a dream. I mean, I had a dream really to work with Project Hope, that I wanted to be on board that ship, and I wanted to help people, and I wanted to do that. I want to just mention a thing about finding a job. My daughter has a master's degree in library from Drexel Hospital. She wasn't able to find a job. She wasn't able to find a job. So she was at home. Her boyfriend gave her a certificate to go take a knitting class. She went to the knitting class. She talked to all the people there, and they told her, you know, they got to know her. And I'll be darned if one of those people wasn't a retired person, a librarian from one of the district libraries. And she found out about a job, and she traced my daughter down. My daughter applied for that job, and she got that job. Would she have gotten that job if she hadn't done that networking? So it's very important to listen, to share yourselves, to get involved with HEMA groups, the Chicago group. It's great. Go to those meetings, because when people see your name, they know who you are. And when you're applying for a job, they will know, you know, they have that personal experience with you, and they are more likely to get you to the top of the pile. So I can't tell you to network enough in these days where you can't get in an HR department to talk to somebody, to network in all kinds of ways that you can, through LinkedIn, or just get your name out there. As I mentioned, always have a dream. My dream was, this was Project Hope, and this was the ad that was in the Newsweek at the time, this little girl, and how they went around the world on this ship, the SS Hope, and it started in 1958.
Do you still do this?
Actually, the ship was dry docked in 1974. It was so hard for me, because it was dry docked in 74. I did not graduate until 75. But it was still my dream. Okay, so let me see, we're going here. Whoopsie. Where are we going here? Gotta go back. All right. When I left college, I didn't know what I was going to do. I had my baccalaureate degree. I had my ART. I didn't have my registration yet. I decided that I just didn't know. And all of a sudden, the director of our medical record program, which at the time the HIM program, took me to lunch and she said, I want to offer you a position at the college, at Mercy College, as an instructor. I nearly died. I had no idea about that. But I was, you know, I had listened to the mentors. I had been through this associate program. I had done these things, and I was very lucky. I was very lucky that they selected me. I worked for Mercy College in Detroit for 1 year because my dream was here. So in January of the same year that I graduated and I was working at the college, I applied to Project Hope. Project Hope was land-based, but they had 2 medical record or health information programs available. One was in Jamaica and one was in Egypt. They wanted medical record, I'm sorry, I go back and forth between medical records and health information because it was the way the career, how we developed. But they were working at the Cancer Institute in Cairo, and we needed a team approach. And they wanted, as part of the team approach, to go to the Cancer Institute in Cairo, which is over here. If you know the map, right, because Cairo is here. They wanted, as part of the approach at the Cancer Institute, to have a trained medical record person. And I was 22. Now, I have to say that once I got to Cairo and people came over from headquarters and they looked at me and they said to me, I had interviewed at headquarters, and they looked at me and they said, well, how old are you? And I said, I'm 22. Well, so you can't ask. You can't ask, and you don't have to give. So I said, I'm 22. Well, we don't hire people that are 20. You know, it's how you act professionally. It's how you sell yourselves. When you go into an interview, if you know what you're talking about, you can do it. You don't, you know. And also the CV with teaching and all that helped me. Also, I had coded in a hospital and done a lot of things. So if you build your CV, always remember to build your CV. One of the big things as I was working in Cairo was not only I was working as a team with an OR nurse, nurse director, cytologist, lab tech. We were working as a team to build the Cancer Institute there. But boy, you needed basic experience. You have to know how to begin from the beginning when you're working in a situation in like it was in Cairo. You need to know, how do you start an index? How do you start an alphabetic index? And these kinds of things. And it's always good to know that, because you, in today's world, you can justify it by saying this is how you need to start. If you're starting with an electronic medical record, you need to know how to begin. So you have to begin from the beginning. What is an alphabetic index? What is a disease index? And how do you use a disease index in an electronic world? You know, we used to do it on cards. I mean, we used to do it on 3x5 cards where you have alphabetic index. It's hard to alphabetize Arab names, because they have 4 names and they could be Mustafa, 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 Mustafa. Right. And, you know, and they did not know how to alphabetize. The things that we think are very usual were not usual for us there. When I got into the department in Cairo, all of the records had been dumped in the middle of the floor like this. They were all in plastic bags for the medical records. They were all dumped in the middle of the floor because they were building a new wall. So it's just like if they were building a wall in the middle of here. So instead of shifting all of the records, they dumped everything in the middle of the floor because the guys were mad. They wanted to get building. They all had cement all over them. They were in no order whatsoever. So you don't know what situation you're going to get into when you go into any hospital. Hopefully you don't find anything like that today, here. But you could, if you went into a nursing home, you could You need to know how to start, what kind of filing systems to use. You need to know all of the things that your mentors are telling you here. All your teachers are telling you those filing systems and all that. It may not be electronic if you get into a nursing home. And they do need people, so, but you need to roll up your sleeves. The other thing about being in international work was they didn't speak English, and I didn't speak Arabic. So it was really interesting for a while. It was really interesting for a while. An interesting fact about Cairo and Egypt is the schools, the medical schools taught in English because they were a former English colony. I don't know if you all knew that, but they had British troops and British colony there. So they taught the medical schools in English. So even though the medical record staff, they didn't understand any English, the nursing staff didn't understand English, they had the orders from the doctor were all written in English. And so it was a bizarre thing for me when you're looking at quality, okay? When we were looking at statistics, you all think about statistics. You know, we used to do all the statistics and so forth. But I was doing the census. They'd never done a census in all of the Cancer Institute. It was 200, 300 beds, something like this. And so I wanted to do a midnight census on the different wings of the hospital because they had never kept them. They just didn't feel the importance. They were paid from the government for the services. So it wasn't a system like we had. They were paid by day, how many days the patient was in the hospital. It didn't matter, okay? And they just threw out numbers. Well, when I started to do the statistics, it was quite interesting because we had 200 and I wanted to say 86 beds, something like that. And I got down all of the evening sheets. You know, you get the midnight sheets, you got the admission, you got the discharges, you got your transfers, you got all this, who died, and all of that kind of stuff. Well, when I added everybody up, and I had done a bed count, because you have to do a bed count before you can do the stats. Well, there you are, we had more than 300 patients. I'm going, well, how do we get more than 300 patients? So I started checking around. We had 20 more than we had beds, right? Well, come to find out, if they had more patients, they put 2 patients to a bed. And they would be sleeping head to feet on the beds, you know, because they didn't have. And that's how we had a census that was bigger, and you just have to recognize it. And it's not something that, it was out of necessity for, and it wasn't a problem for them. At least, that's what I was told. I did not talk to the patients, I didn't, you know, but it became interesting, and you have to be very flexible. We worked as a team, we built a team. I left there a little bit disheartened. I thought if I ever went back to Cairo, that things would go back to the way they were. I had started this disease index and operative index. I had started the alpha index, and you know, charts were all in order. All of those things were in place. Very basic record department. When I went back in 2 years, they asked me to come back. Well, actually, I went back with Westinghouse, and it just happened to be their office was down the street from the Cancer Institute, so I thought I'd stop over. Oh my gosh, I walked up there, and they had computers in the department, and they had computerized everything. They had taken everything that we had discussed and rolled it and ramped it up and had gone to get a grant to put in equipment, and they had done, they could see the value. And that's what you can ask, is that they do better at the end, that what you educate, and that's what all the educators in the room would say, we want you to be better than when you came in the door. We want you to do all of the things that you can do and build on those, keep learning. I'm sorry, I talk a lot. I came back, I got married in Egypt. It was good that I got married. I have a daughter and a grandson. I'm divorced now. We were married 7 years, but that's okay. I mean, that happens in the United States too. But I came back and I became the director of an HIM department at a community hospital in Hillsdale, Michigan. And I was there for 6 years. And in that time, there were a lot of changing times in healthcare in the early 80s, where you started doing the utilization review, the DRG started, the medical record information was changing, not the information, but how you utilize it. You no longer, it wasn't about indexing procedures, indexing diagnoses because of research or because of auditing, because of quality of care. All of a sudden, the coding became very important for financial reasons. And we were right on the cusp of that. At the same time, we were going through the universal billing, where, you know, it used to be all the billing was, you did fee for service, and the billing, whatever the hospital wanted to send in, they sent in. There wasn't a universal bill. Everything looked different. There were a lot more people, obviously, who were taking care of the billing than there are today, because we have computers and all of that. But that was what was happening to us then. You think things aren't changing, but they're changing. And it's, you know, to keep up, you have to keep yourself informed. Don't let yourself, even if you have to go off and have a baby, or you know, you're not in the work, you need to keep informed and keep up to date. It's very important. You need to, when I was there, I kept growing, and I added responsibilities. I took on admissions, I took on UR work, and it was, you know, you just keep doing. We did union negotiations, all kinds of things that you can make yourself available to do if you want to be challenged. Challenge yourselves when you get into your professions. Do something different. Well then, oh my goodness, Reagan, you do remember President Reagan. You are old enough to remember him. He invaded Grenada. And you may remember Clint Eastwood and going on the beaches, and they went into Grenada. Well, Reagan came to my boss, who was Dr. William Walsh, who started Project Hope, and all of the Cubans left Grenada. And they had nobody, no doctors left on the island. And they asked us to bring in doctors and a whole team. And so it began 3 years of my life spent in Grenada. We're at the point where we didn't have electricity when I got there, because they had blown up all of the electric generators, and we got to a point where then we had 5 hours a day and then different things. Now, I had my house right up in here. Great spot. Had a swimming pool. Looked on Grand Anse Beach. This is Grand Anse Beach. It added 10 years to my life to have these 3 years. If you've never lived on an island, you know, it can wait. Things can wait. You're not going anywhere. You're not getting in a car and going, you know, 400 miles away. Everything just sits right there. And some of the things, you know, you need to do. One of the biggest things I think that I did there, and what you can think about, is if you go into a place, a healthcare facility, and they're not using the medical records for healthcare. They were not using them for healthcare. They never asked for a chart to come back when a patient came in for clinic. They didn't think that they could get a chart. So the first thing is that we organized all the records so that they were available. And once we got all the records available, the doctors would not see a patient without a chart because they saw the value. So, you know, a lot of time you've got to sell. It may not be this part, but you have to sell your expertise. You have to sell your coding. I talk to my coder about this all the time. You know, I want you to talk to the providers. They need to respect you. They need to be able to come to you and talk to you about a diagnosis. And they have to know that you understand and that you will have the answer. If you don't have the answer, you want to find out. Say, I'll get back to you on that. Let me investigate that. Let me check my resources. You know, you never say you don't know. They never say that. You need them to respect you, okay? And you should always have your resources. One of my mentors at Mercy College, she became a HEMA president. And she told me, I don't expect you to memorize this book. In fact, I don't think you can memorize. But I want you to know where to find the information, how to find the information when you need to. And you know, all the information in the books I studied in is long gone. But what do I look at? I look at the websites. I look at I'm always looking. Every day I look up something new and check my resources. When my boss is asking me, I'm talking to him. So that was 3 years, 3 wonderful years. Well, USAID, which is the government, who was paying for a new psych hospital and everything because they blew it up when they got on Grenada. These are the, you know, the days that happened. And my contract was up, and they asked me to come back to headquarters. So this was a big, diverge, kind of I was going away from medical records. They wanted me to do administration for other programs. They wanted me to do programs in China and in Indonesia, Portugal, from headquarters, so that I was the, what they call desk officer at headquarters. And that's what I did. I did that from '89, and we were involved with the 1989 Armenian earthquake, if you ever remember that. There were a lot of people that were harmed in that and killed because of the buildings being so kind of old. A lot of people lost their limbs because they were trapped under buildings, and so they lost their limbs. So we did a big prosthetics program in Armenia. But that led me to meet Mrs. Bush. And it was very funny. I was talking to the VP in charge of international in our office, and I said, he got a phone call, and he said, "It's Mrs. Bush's secretary on the line for you." And I go, "No, you're joking. You know, it was because we were going to have her out at the airport when we brought in some small amputee patients who were then going to be sent all over the world. So, you know, having experiences like that are wonderful. But I never did go really any place at that time, and this is where I talk about speaking up, because there became a job opening in 1991. You know, the wall, the Cold War kind of ended. The wall went down in Germany, and we opened programs in Eastern Europe. And so I wanted to go. So I had to go to my bigger boss, and I had to tell him that I could do the administration that was necessary in Czechoslovakia at the time, and go to Czechoslovakia and build those programs. And we had 4 programs. We had healthcare management, we had biomedical engineering, we had maternal child health, I forget what the other one is, BME. But anyway, and we had this money from the US government to go in there. And we had to set up offices, we had to hire people, we had to do all of these things. And I said, I can do that. I spoke up. I said, I have the skills, but you're a records person. I said, I'm a management person. I can do this. I can do budgets. I can do whatever is necessary. So it took me completely away from what I had planned. I was at headquarters. I wasn't really doing records anyway, but I was then taken on to Europe. And I started out over here in Bratislava. And it was Czechoslovakia at the time. And do you know who was the ambassador to Czechoslovakia? Anybody remember? You all know this person. Very famous child star.
Shirley Temple.
Yes. She was the ambassador to Czechoslovakia at that time. And we built programs all over Czechoslovakia, in Budapest, in Romania, over here. We used to go across the border from here to there to do nursing programs. I used to drive everywhere. So anyway, but that we had our healthcare management program. I was very involved with the healthcare management program and brought in experts from the United States, and they taught a lot of the things that you all know about finance, you know about trying to think, human resources, all these kinds of things that are in management. And so we developed programs for administrators of hospitals because they were doctors. The doctors there, a regular doctor is paid about $50 a month. That's what he was paid when I got there, $50 a month. I can tell you in Cairo, my medical records staff there were paid $20 a month. Okay, so that's what.
Enough to live on?
Well, you know, it wasn't a whole lot of money. What the doctors did here, I mean, it was the former Soviet Union, and they did a lot of black, what do you call it, under the table money.
Black market,
Yeah. And so before you could have any surgery, you had to pay the doctor under the table, or he wouldn't do your surgery. So we were talking, and when we were trying to train the doctors in these places, just trying to get them to say they could make a change. Change management was a big part of that. As it is today, as you go into EMR, change management, I mean, geez, it's hard to get the doctors to change. So you got to use every skill you have in your book to get them to move from a paper record to EMR. But we do it. Anyway, so I was there. Then I moved to Poland, in Krakow. I was in Krakow for 4 years. Then they called me up in the middle of one Saturday night, like at 11 o'clock at night, and said, we need somebody in Kazakhstan. And
you went willingly?
And I went. I lived over here by China, right here in Almaty. And I became regional director for 5 countries. We had more than $35 million budget running between 7 countries, Ukraine, Russia, Kazakhstan, Uzbekistan, Turkmenistan. We ran tuberculosis programs. And with the tuberculosis programs, we had more than 100,000 lives saved during the time that I was there. Lives saved because of the TB programs. We worked with the Global Fund for tuberculosis, HIV, and malaria, and we helped the governments there to get grants to bring in the drugs. Drugs for TB, unless you didn't know, the drugs for TB, you have to take a course of approximately 6 to 9 months, depends on the drugs, $25 to save a life. $25. And the governments, they didn't have it. And through the Global Fund, through the WHO, this is what we brought into these government. We wrote the proposals. We couldn't get the money ourselves. We assisted the Ministries of Health to get those grants to save those people. And TB and malaria and all that is, I mean, it's in Africa a lot. HIV, it follows HIV because HIV, you have your immunity that is down, it allows the TB to show up, I guess is what you want to say. So, that's where we were. But I left Almaty. I was called by Dr. John Wilhelm, who is my boss now, and I was ready to leave because I'd had to evacuate my staff out of Uzbekistan because of bombings. You can see right here is Afghanistan. I was working in Tajikistan, and the ambassador to Tajikistan was living in Almaty, and they said, oh, we can't go in there, but you can go in there. You can go in there. So I would go down there, and I had my staff, local staff. We had 160 staff in the whole region, and I had staff down here working in TB. And, it got a little scary. But you can see how you can use your knowledge. What you gain today, you can use it if you take your opportunities. Okay. Anyway, so I decided that I was pretty much done with the bombs and the, when we were working with people in Kyrgyzstan, they were going down to Afghanistan, they were coming back. I had Thanksgiving dinner in Turkmenistan at the ambassador's house, and there were trucks that were taking stuff into Afghanistan to the for the troops and so on, and they would pass through Turkmenistan on trucks, and we had Thanksgiving with these guys that didn't know whether they were going to be around in the next days. So it sounds like a very exciting life. A lot of airplane travel, a lot of Moscow is very interesting. All the countries are very interesting. Everybody says, oh, well, you must have traveled, you must have seen a lot of things. Yeah, you saw a lot of things. Saw a lot of health. Very fulfilling job, because you knew you were making a difference. You were supporting the people. And at the time, Russia really dropped these countries, and they were only allowed to build, say, the axles of the trucks. They didn't have full factories. And so, you know, it was really hard. There wasn't food. When I went out there in '91 to start up the first office in Kazakhstan, that's when I was still working in Poland. They asked me to go over and set up. We did it on the RLC with Chevron. Chevron gave us $25 million to set up a health program supporting this area. And, you know, it's interesting. Look up, you can see Project Hope if you're interested in more things on them, what they're doing today. There's a website. I'm on their alumni committee.
What did $25 million set up?
Well, we worked with their hospital locally. We trained their nurses. We trained their doctors. We got a mobile TB clinic to go out and find those TB cases, bring them in, get some drugs. You know, a lot of health care brought into that region that the local government was unable to bring in. I felt when I stepped off the plane in Ajarau, out in the middle of nowhere, I felt like I was a school marm in the Old West, because the main street was dirt. It was dirt. We had one administrator come out there, and it was midnight. Two of us came to set up the offices there, and this administrator, he came to the door, he said, you need to get me out of here, and you need to get me out of here now. You know, he wanted out, he culture shock, and we had a lot of people go through culture shock where they couldn't deal. Anyway, continue to be challenged when we move to EMR. Back in the US, I'm in infant welfare. Keep up with your profession. Don't let it go by just because you're coding or whatever. You need to know everything else that's happening, because you don't know what's going to happen tomorrow in the profession. You've got to keep it up. Words to live by. I'm going to quickly, I'm sorry, I don't want to run over too much. Always listen to your mentors. That's what I did. Listen to them. They tell you exactly where we're going with it. Take and make opportunities for yourself. Take and make them. They're not going to give them to you. Okay? I took the opportunities, and I've never really had to search for a job. I've been very lucky. Do what scares you a little bit. You know?
That's good.
Yeah. You know, getting up, I mean, I went to the Polish White House where meeting with the president's wife, and she was a mentor for our breast health program. Wow, you know, that's kind of scary. Meet Mrs. Bush, you know, do these things. It scares you a little bit. Believe in yourself. Jump off the diving board. Get out there. Move along. You can do it. Everybody has their story. Always be happy in what you do. I've never gotten up in the morning I didn't want to go to work. I think there's nobody that probably has a better sick history than myself. And I lived overseas where there are a lot of bugs. I went into multi-drug resistant hospitals, TB hospitals. I've never been sick.
That's a blessing.
That is a blessing. I'm very lucky, because I went into the prisons. I went into places where they have really bad TB cases. If you've ever, you need to look up TB. It's a very interesting disease, old disease. Be sure to follow your gut, and you know, watch yourself. Be inspired and always speak up. This is a little thing that I just found recently, and really why I did this talk, because I was inspired by Sheryl Sandberg, if you all have been maybe heard. But Mark Zuckerberg said to her during an evaluation, when you want to change things, you can't please everyone. If you do please everyone, you aren't making enough progress. EMR in Infant Welfare Society. I started an EMR committee in 2008. I couldn't get the board or the CEO to support an EMR until 2011. And we went live in October. This last October, we're going live with the dental department in April. But if you aren't rocking the boat, you aren't going to making progress.
That's right.
And you know, and this is the book. Lean in. Women Work and the Will to Lead. And I'm sorry for the gentleman here that has the lean in is for women kind of.
We want men to read it also,
yes,
don't we?
yes,
I mean,
but
I think
lean
it's
in,
great.
lean in, support yourself, be professional. That's it. I gave you a bunch of other stuff on healthcare, but I'll leave it in there.
Can we?
It was kind of dry.
Can we send the PowerPoint?
I think
I
I will. So I hope you learned a little bit of something and questions? I'm sorry, I kind of went over.
That's all right. This is amazing. I mean, this is your history, work history. I had no idea, Deb. I'm so glad you came to share this with us. Does anybody have any questions?
Are you multilingual now?
I speak Arabic still, but once I got into Europe, the languages, Slovak, Czech, Polish, and Russian, they all have variances, and I found out that when I tried to speak one and the other one, I ended up on the wrong train because Tuesday meant 2 weeks from now, and things like that. So I understood a whole lot. German I understand. I can do anything with directions because I drove over there. So I knew how in all languages to do that, but I always had a translator because of the problems I had on a regular, and my translator, his name was Henry, and he would say things. I would say something and he would go on and on and on. He says, but you forgot to say. You forgot, you need to tell them.
You can tell.
And he knew how long, he had been with me so long he could tell everything, but always did a lot of newspaper, did a lot of television to support the programs, met a lot of very wonderful people, but the biggest things was that we changed the health of the people in those countries. And that's, that is what, it isn't nothing, I just want to share that with you because what you do, you do that here every day. What you do in coding, what you do for healthcare, you are doing the same thing. It may not be as flashy as you might think, but what you do, it's just like the EMR. Getting that EMR over that hump was really hard. You just gotta keep pushing.
Yes.
Use all of your expertise.
That's right. Appreciate it. Now it's time for you to write your book. And I'm going to read it. That's a great book right there.
I envy you the history. I like watching things grow and develop like that. And you had a lot of experience with people who had no experience with this. So.
Yeah.
It's amazing.
But
Amazing.
I wasn't in records for a long time. I wasn't in health information, but when I came back to info welfare, it was like getting back on a bicycle. It was very easy to, I had to do some catching up because I had been overseas, didn't have the educational opportunities, we didn't have the internet the same way. But you can do that. You have to, you have to do that. I had other educational things that I put in for my registration. Where I would go to TB conferences, I would go to other kinds of things.
For your CEUs?
Yeah.
Yes.
So different kinds of things. I would read articles from the AHIMA book journal.
And to keep up to date.
Yeah, because I never lost my registration, ever. Don't ever
do that. Yes. You worked hard for it. Keep it up.
And it's important.
Well, thank you so much. We appreciate you. Yes, we do.